Good morning. This week marks 6 months since Canada announced its first case of COVID-19, and it was related to international travel on January 25th. It's also been 6 months since the World Health Organization declared COVID-19 a public health emergency of international concern. So we've learned a great deal about COVID-19 in the last 6 months and continue to learn more each day. Around the world, there are over 16.4 million cases of COVID-19 and over 650,000 deaths. In Canada, we have more than 114,000 cases, but 87% of these cases are considered recovered. 85% of the cases and 95% of the deaths have occurred in Quebec and Ontario. The last week, though, has shown a 38% increase in cases in Canada compared to the previous week. And although Quebec and Ontario account for 64% of the new cases in the country, British Columbia, Alberta, and Saskatchewan are also experiencing an upward bend in their COVID-19 curves. This week saw a 36% increase in new cases being reported outside of Quebec and Ontario. 61% of the new Canadian cases are in people under the age of 39. The initial results of a Canadian study indicate that less than 1% of the Canadians tested positive for antibodies against COVID-19, meaning a very small percentage of Canadians have been exposed to this virus. These early results indicate that most Canadians remain susceptible to COVID-19 and that we must remain vigilant in our public health measures and our testing and our contact tracing. Globally, COVID-19 continues to spread at an alarming rate. Each week we learn of a new record number of cases in one day, and this week was July 24th and 25th when over 280,000 cases were reported on each of these days. The United States continues to be a world leader in the incidence of COVID-19 with over 4 million cases, and this represents 26% of the cases worldwide. And with over 1 million new cases in the last week, the situation in the United States is a daily reminder of the risk of resurgence of COVID-19. We are learning more about the virulence of COVID-19. In some parts of the world, for instance Australia, where there was a low incidence of the virus and where it appeared to be contained, are now experiencing a resurgence. And so some jurisdictions have had to tighten restriction, and we don't want to have to follow suit here. So we are not out of the woods, and we cannot afford to let our guard down. But I'm happy to report that there are no new cases of COVID-19 in PEI today, and all 36 of our cases are now recovered, and we have no active cases in PEI. No one has been hospitalized. It is encouraging to see that many more islanders are wearing masks when in indoor spaces, such as grocery stores and retail outlets. Masks represent one layer of protection against COVID-19, but they do not replace other, more effective public health defenses against this virus. Wearing a mask does not replace public health measures, and we need to maintain a physical distance and practice good hand hygiene, for instance. And that protection is really important when you think about physical distancing. So if we're unable to maintain the adequate physical distance when in a closed indoor space, wearing a mask is expected. It is also courteous and respectful of other fellow islanders. I would like to note that masking is challenging for those who have difficulty hearing and rely on lip reading. There are some masks available with a clear window where you can see someone speaking, and I raise this for awareness. As mentioned last week, we want to carefully increase visitation and contact between long-term care residents and loved ones. At that time, Premier King correctly pointed out that some islanders want the easing of restrictions to be slow and incremental, while the reopening of services cannot happen fast enough for others. The team focuses on taking a measured and evidence-based approach to easing restrictions that balances reasonable risk with our top priority of protecting the health of Islanders. So the changes being announced today are another step forward to increase visitation and support for our seniors who live in long-term care facilities. Long-term care residents can now choose a person to be a partner in care, and these individuals will be able to visit the resident in the room anytime during regular visiting hours, provided their visit does not have a negative impact on the care of any other resident. The designated partner in care will assist with basic care, socialization, feeding, mobility, comfort, and companionship. The partner in care will be oriented and trained in the appropriate use of personal protective equipment. An example of a partner in care may be a husband who is used to going to the nursing home every day to visit his wife and help her with lunch or to play cards. Another example is a daughter who visits her father multiple times per week to read to him and play crokinole. We know that long-term care residents, their families, and loved ones have missed having regular contact with one another. And of course, we're pleased to know that residents and their families are now able to select an individual to spend more time at the long-term care facility visiting and caring for their loved one. In addition, the requirement to have 6 designated people as visitors has been removed. Long-term care residents will still be able to have 2 visitors at a time, but there will not be a limit of 6. Residents of long-term care will be able to go for drives with their partner in care. These changes apply to both private and public long-term care facilities. We recognize that long-term care facilities have different capacities to implement these measures. Please be patient as our long-term care facilities take the necessary steps to implement these very positive changes. Not all facilities will be ready to go with these changes immediately. So again, asking for patience. Effective immediately, the Family Connection stream is open for allowing family members of PI residents who are Canadian citizens or have permanent residency status and live outside Atlantic Canada to travel to PI to visit their family members. We know that many Islanders have strong connections with family members who live elsewhere in Canada. Many of these families travel to PI every year, and these visits are important to maintain their connection with their island family and friends. We also know that many island families look forward and enjoy when their family from away come home for their annual summer visit. Individuals wanting to travel to PI under the Family Connection stream are required to complete a declaration form and receive pre-travel approval from Justice and Public Safety prior to traveling to PI. As well, an island resident will be required to sign an attestation as part of the pre-travel approval process. Due to the anticipated volume and the need for a thorough review, individuals can expect the processing of their applications to take several days. These individuals will be required to self-isolate for 14 days and will receive their calls from Operation Isolation. The application will be online by noon today and can be accessed at the Public Safety website. Since June, we have welcomed over 2,100 seasonal families to PEI. In every case, these individuals have completed their 2-week self-isolation period. In the coming weeks, we are going to be welcoming more people to the province. We know, for instance, that post-secondary institutions are planning for the safe arrival of international students and domestic students who live outside Atlantic Canada. All of these students will be required to complete a 14-day period of self-isolation. Work is underway with post-secondary institutions in PEI. On the topic of education, and as a parent myself, we are all anxious to learn more about the return to school in the fall. And our office is reviewing the proposed plans from the Department of Education and Early Childhood, the Public Schools Branch, and the Commission Scolaire de la Langue Française. Since the Atlantic bubble started on July 3rd, a total of 42,894 vehicles have traveled to PEI, and that includes the bridge and the ferry. And since mid-April, 375 individuals have been denied entry to PEI. Currently, there are 723 individuals in self-isolation in PEI, and 7,121 have completed self-isolation to date. In terms of testing, since the pandemic began, 19,160 COVID-19 tests have been processed, including over 1,500 in the past week, and PEI remains well above the Canadian average in testing per capita. As of July 27th, there have been 1,060 routine COVID-19 inspections conducted, with the majority being satisfactory. And typically, the unsatisfactory inspections relate to not having or not following an operational plan, and most issues are resolved on a follow-up inspection. We have received 32 complaints related to businesses and organizations, and 23 are resolved. So on reflection, the uptick in cases across Canada is a concern. We are learning more about the risk of spread of COVID-19 at large gatherings where physical distancing is not respected. The virus is transmitted easily when people are in crowded, closed spaces with close contact. And I understand it is difficult for all of us, and especially young people, to be restricted to being in a small group. And we know summer in PEI is synonymous with large gatherings of families and friends and parties and attending festivals. But this summer is a bit different for all of us. Although some of the restrictions on gatherings and events have eased through Renew PEI, things are not back to normal. We still have to be cautious and avoid high-risk situations. So what should we be doing? We should manage our own risk and recognize that our individual actions affect ourselves and others. We should avoid attending events where we do not know most of the people in attendance. We should make good choices about where we go, who we are with, and what we do. We should limit the time spent in shared facilities such as change rooms, restrooms, and we should be guided by the principle coined by a colleague out in British Columbia, Dr. Bonnie Henry, of seeing fewer faces in much bigger spaces. We should take other steps to minimize our exposure, such as trying to maintain physical distance, and if we cannot, we are expected to wear a non-medical mask. As we move into the last week of July, early August, I encourage Islanders to visit new places in our beautiful province. And as always, continue to look out for one another and be patient, be kind, and compassionate to yourselves and one another. Thank you. And I'll open it up for questions.
Louise Martin, CBC.
Oh, hi there. Excuse me. Hi, Dr. Morrison. I'm just wondering about, I know you mentioned masks, and some other jurisdictions have indeed gone ahead to make them mandatory. I know we've asked you this before, and I know certainly some people cannot wear a mask for many different reasons. At what point do you think, or what would be the trigger for PEI to consider making them mandatory under certain circumstances?
Hi, Louise. Absolutely. We are seeing some mandatory masks being put in place in different parts of the country, and we're watching that closely. I think the things that would make us want to move to mandatory masks are if people are not wearing the masks in sufficient numbers here in Prince Edward Island, and looking at our epidemiology. We have continued to do a large amount of testing. We don't have widespread community transmission. That's evident, so we will watch that carefully. And if those would be a couple of factors that would come into play to make this, to make non-medical masks mandatory. I think it's really been incredible to see the amount of mask use that's happened in Prince Edward Island really in a short period of time. And I think the education around it, understanding why we're doing it and in what settings will continue to be important. And if we've said right along, if we need to make it mandatory, we will. But at this point in time, I think it is about education, understanding, and watching what is happening from an epidemiology point of view as well.
Thank you. And I just wanted to get you to expand on, you mentioned schools and the operational plans. So the Minister of Education had said we can expect some details in the coming weeks. And he had also said that, there would be broad stroke plans overall, but also the individual schools are all different, so they may need different modifications, different needs depending on, the size of the school, how many students go there. So I'm just wondering about how the Chief Public Health Office is handling that many operational plans. Are you getting them individually from each school? And when can you expect to sort of approve those plans? What does all that sort of look like?
So we are not getting individual school plans, but we're going to be looking at plans from groups of schools. So for instance, elementary schools, for instance. So I believe there's 6 more individual plans to look at, as well as a general plan, and those are currently being looked at. And I think the announcement will come from education within the next week would be my anticipation.
Thank you so much.
Okay.
Wayne Thibodeau, CBC.
Yes, good morning, Dr. Morrison. I wanted to chat with you a bit about the family connections and bringing sort of people into long-term care homes, and the challenge you and your team faces, the sort of balance as you speak about being able to get families reunited with the risks of COVID entering these senior homes. And also, if you can just clarify whether or not any homes can opt out, or whether all homes will be now offering this going forward.
Hi, Wayne. It is a balance, and I think you've seen in terms of the visitation at long-term care facilities going from outdoor visits to indoor visits, and now a next step here, and we imagine there'll be further phases as well. But we're trying to protect the residents, and I know families want that too. But obviously, the connection between the residents and families is extremely important. The way the directive is, it allows these visitations and this connection to happen in terms of a personal care person being designated, and it will mean that Health PI will have its policy that will reflect that directive, but also the private homes will have similar policies. They may not look all exactly the same, but I think there's certainly the goal is to have some consistency among the public and private long-term care facilities. But again, as I mentioned, not all will be able to do it all on the same day, and there will be some education, for instance, around or for the person about personal protective equipment, and that's really important. Making sure that residents do identify someone that they will have that closer interaction with, and so that will not happen all of a sudden, but it will start, and it will be really important for the residents and their families.
If I could also ask you about the 375 people who were denied entry, without getting into very specifics, can you give us some sense of why people are being denied entry into the province and how that process works?
So the denials would be if they, for instance, turn up at the bridge and they do not have pre-approval travel for whatever reason. So maybe they've driven in from Ontario and they were just going to come and take a look around PEI, and have a holiday, and right now in PEI that is not. You need to have pre-approval travel for that, and then it also allows us to, if someone is coming for a certain reason, we need to be able to put them, be able to get them involved in Operation Isolation so that they isolate for that period of time. So that would be one example, Wayne, where if the pre-approval travel is not in order, they would be denied entry.
Thank you.
Junie B, The Guardian.
Hi there. Good morning, Dr. Morrison. I just had a question, I guess, about the partner in care. I wonder if you could tell me a little bit more about sort of what the requirements are for those designated in this role, like whether they will need to be tested, and I'm wondering why the province went with a limit of only one. I think Nova Scotia allows, I believe, 3 within long-term care facilities.
Hi, Stu. So 2 things. We have, in consultation with the private facilities and health PI, the decision was made to start with 1, but knowing that we may quickly move to 2. But I think there was a recognition that we start slowly, and then if we need to add more, we can, and that can be done. So I think that's part of it. I think the first part of your question was around testing of partners in care. So that is a possibility, and that'll be reflected in the policies as well. So, and also partners in care, for instance, would not be going between facilities. So you wouldn't be a partner in care for one resident in one long-term care facility as well as a partner in care in another long-term care facility at this time. So there are some of those details that I think will be the homes themselves will be wanting to look at and follow carefully. Testing may be an option, but not necessarily.
Okay, and I guess just a bit of a broader question. Several weeks ago, the Minister of Health had announced that there was an internal review of long-term care facilities. Just wondering if there's any kind of update that you can provide on that.
Stu, that I think probably best directed to the Minister. I don't have any update on that.
Okay, thanks.
You're welcome.
François Cardufault, Radio-Canada.
Bonjour, Dr. Morrison. Dans un premier temps, pourriez-vous m'expliquer en français les changements que vous annoncez aujourd'hui pour les visites dans les foyers de soins de longue durée de la province?
Bonjour François. Alors, on annonce aujourd'hui un changement pour qu'un résident des foyers peut vraiment choisir quelqu'un avec qui il peut avoir plus de contacts, plus réguliers pour un bon bout de temps, qu'il visite chaque jour pour aider, nourrir, jouer les cartes. Ils vont porter l'équipement pour l'équipement personnel protectif, mais quand même, il peut être plus proche et de faire plus de choses avec le résident. Alors, c'est un changement et c'est fait dans plusieurs provinces. Et puis, c'est une autre étape pour avoir plus de contacts et plus de visites. Alors, c'est en particulier ça. Et puis, la limite de 6 visiteurs n'est pas là maintenant. Il peut avoir plus de visites, mais c'est seulement 2 à la fois.
Et une autre question, si je peux me permettre, Dr. Morrison. Au début du mois de juillet, vous annonciez des nouveaux cas. Vous étiez inquiète pendant une bonne partie du mois de juillet. Aujourd'hui, vous nous annoncez que la province est de nouveau au niveau d'infection 0. Comment vous vous sentez aujourd'hui après avoir traversé les 3 ou 4 dernières semaines?
Je pense que je suis toujours un peu inquiète parce qu'on sait toujours que on fait toutes les choses qu'on peut pour protéger les insulaires, mais quand même, on peut avoir les cas. Et on sait que ça va arriver, mais les plusieurs cas en 1er juillet m'inquiétaient plus parce que c'était à propos des foyers à l'hôpital. Alors, c'est un plaisir vraiment d'annoncer qu'à ce moment, on n'a pas les cas actifs ici à l'île du Prince-Édouard. Alors, oui, aujourd'hui, je sens un peu mieux, mais encore, je vais rester inquiète, j'imagine, pour un bon bout de temps.
Merci beaucoup.
Merci.
Rachel Collier, Eastern Graphic.
Hi there. I guess my question today, I'm not sure if Marian Dowling might have been better for this, but my question is, has reallocation of healthcare staff to accommodate the COVID-19 response, has that contributed in any way to staff shortages or closures at Western Hospital's emergency care centers or centers?
Hi. So I think that's probably a question that that Marion can answer next time, and because that would be more specific for Health PI to respond to in terms of reallocation of staff and Western Hospital. So I will let them respond, or perhaps we can send you something afterwards by email.
Okay. That was kind of my main question, but I guess, do you know how many people have possibly been turned away because they have presented symptoms at the bridge and the questioning of if they have a fever and so on?
A very small number would be my sense from in terms of the denials.
Okay, thanks for that. Have a good one.
Julien Lecacheur, Radio-Canada.
Bonjour, Dr Morrison. Vous l'avez répété à de nombreuses reprises en français et en anglais que vous ne souhaitez pas rendre les masques obligatoires dans les lieux intérieurs, comme par exemple des magasins, etc., etc. La province de la Nouvelle-Écosse va obliger le port de ces masques à l'intérieur à partir du 31 juillet. Est-ce que vous pensez réellement faire de même, ou est-ce que tant qu'on n'a pas de cas ou de véritable transmission communautaire, selon vous, il n'y aura pas besoin de rendre ces masques obligatoires?
Bonjour. J'espère que avec l'éducation et un grand nombre d'insulaires qui vont porter les masques non médicaux. Et si on a, comme vous avez mentionné, si on ne voit pas beaucoup de transmission communautaire, on ne va pas avoir les masques obligatoires, mais si ça change et si il y a beaucoup de gens qui ne portent pas, si l'épidémiologie change un peu, on va changer changer et on va faire obligatoire. Mais je sais qu'il y en a des personnes qui ne peuvent pas porter les masques et c'est seulement une façon de protéger les autres. Alors, on va voir. Et puis, c'est quelque chose qu'on discute presque chaque jour avec notre équipe. Et on regarde qu'est-ce qui arrive partout au Canada. Alors, mais à ce moment, on ne va pas changer.
Pas d'autres questions. Merci beaucoup.
Okay, merci. Thank you very much.